Hi, my name is Savannah, and this is our accreditation presentation. The Public Health Department of Alaska Department of Health and Social Services is currently in the process of getting accredited by the Public Health Accreditation Board. They aim at attaining the status by the summer of 2022. This department is one of 5 state health departments in the U.S. which is not initially accredited. Our main concern was that the information provided online was outdated and had not been updated since the year 2018. The Organizational Improvement Manager is the PHAB Accreditation Coordinator for DHSS, along with 12 other team members, all of which have full-time job duties as well. So, the Organizational Improvement Manager works in the majority of the workload related to accreditation. For the research purposes of this report, we focused on developing a plan for completing the CHA in alignment with PHAB guidelines. This included collaboration with a local hospital and treatment or wellness center and acquiring funding. Alaska is the largest state geographically and covers almost 600,000 square miles, with a 2019 estimated population of 731,545 people, 238,379 of which are living in rural Alaska. The state's largest cities are Anchorage, Juneau, and Fairbanks. According to 2019 data from the U.S. Census Bureau, 65.3% of the state's population is white, 3.7% is African American, 6.5% is Asian, 15.6% is American Indian or Alaska Native, 1.4% is Native Hawaiian or other Pacific Islander, and 7.3% is of Hispanic or Latino origin. Alaska Department of Health and Social Services has devoted its Division of Behavioral Health on improving the quality of life of Alaskans through the right service to the right person at the right time. The central purpose of the division is to provide a continuum of statewide behavioral health services geared towards mental health and substance use in this case, ranging from prevention and screening to brief intervention and acute psychiatric care. You can see here we have 3 pictures. One is of Alaska, the state itself, one of the population trends, and the last one regarding continuum of care in Alaska. The mission and values, as well as the vision of the Department of Health and Social Services in the state of Alaska are as follows. The mission of public health, to protect and promote the health of Alaskans. Vision of public health. Alaskans enjoy optimum health and safety through achieving greater public health, community, and personal responsibility for healthy conditions and choices. The values of public health are accountability. We are committed to responsible use of human, financial, and environmental resources. Respect. We provide services without discrimination or judgment. Human potential. We are committed to developing each Alaskan's potential as a healthy individual, as well as fostering strong, healthy communities. Integrity. We are honest and ethical in all that we do. Scientific excellence. We are committed to adding and to contributing to the body of scientific knowledge and using the best available knowledge and data to set public health policy. Their current accreditation progress is as follows. Our group reached out to Heidi Hedberg, DPH Director for the state of Alaska. Heidi responded and gave us the name of a contact that will be able to assist us throughout the completion of our project, Melissa McGuire. Melissa is the Organizational Improvement Manager who is coordinating the process of PHAB accreditation. Melissa works along with 12 other members of the Public Health Department, but she is the main person in charge. Currently, they do not have CHA partnership, but they are aligned with the PHAB accreditation efforts with SHA and SHIP efforts, Healthy Alaskans. They intend to submit the initial accreditation fees and letters of intent by June 30th of 2021, eventually reaching their goal and projection of completing accreditation by the summer of 2022. The Department of Health and Social Services goals and measures are as follows. The goal of ADHSS is to align with the Substance Abuse and Mental Health Services Administration's objectives to fight substance abuse. We will also be covering the financial perspective of this initiative and what is needed from funding and how we look overall to state and government entities. The measurements of these goals will relate to the rates of adolescent substance abuse before and after the program is implemented. The rates will then be used to assess and change the project's goals and objectives to adhere to the needs of Alaskan citizens regarding substance abuse. The first goal is to reduce substance misuse through prevention. This will be measured through statewide implementation of educational services in middle schools and high schools. Evidence-based materials bound through SAM-HSA can be used to provide high-quality education on substance abuse and information to deter the use of drugs or alcohol. Training for educators will be provided through SAM-HSA as well. The second goal is to expand prevention services and treatments, which involves services at the middle school and high school level. This goal, although carried out at the state level, is measurable through local action taken to provide preventative services and subsequent substance abuse treatment for adolescents. Prevention services that adhere to a local population's substance abuse needs will be evaluated through recovery rates. Subsequent treatment success rates for Alaskans will be measured through the relapses and health complications of patients post-treatment. The third and final goal of expanding recovery support services and enhancing the quality of these services. This goal is measured by routine state check-ins, SAM-HSA training for recovery program employees, and retention rates from treatment programs to recovery support programs. These guidelines will aid in the improvement of recovery-related services and ensure that the objectives of this project are accomplishable. The main area of focus is to reduce adolescent substance use and abuse. In 2018, 60% of drug overdose deaths in Alaska involved opioids, totaling 68 cases, a rate of 8.8. And the providers in Alaska wrote around 44.9 opioid prescriptions for every 100 people. Residents of Alaska struggle with alcohol, heroin, methamphetamine, cocaine, prescription drugs, and marijuana. Alaska, due to its location, is a transfer point for drug trafficking. In 2011, the YRBS results indicated that 16% of all Alaskan youths reported taking prescription drugs without a doctor's prescription. The goal of Alaska's adolescent health program is to reduce the percentage of adolescents in high school from grades 9 to 12 who report binge drinking in the past 30 days from 21.8% to 17% by 2020. The Alaska Adolescent Health Program supports adolescent substance abuse prevention efforts through programming and resource development. However, much of the current substance use and abuse prevention work is done through the State of Alaska Board of Behavioral Health and various community organizations. The program is based on the premise that the relationship skills are as important to learn in school as the other 3 R's are: reading, writing, and arithmetic. A balanced scorecard is utilized to measure numerous functions of a business or organization at one time. These functions are both financial and operational in nature. The BSC was developed by Kaplan and Norton after a study that lasted a year and included 12 businesses who were showing top performance measurements. We created a BSC to evaluate the accreditation process of the Health Bureau of the State of Alaska. We have included goals and measures for the following categories: financial perspective, how do we look to potential funders, including the state and federal government, who sets our budget? Diminish substance misuse and overdoses. What must we do better in order to improve the population's health? Expand prevention services and treatment. How can we continue to improve public health in new and innovative ways? Customer perspective and develop higher quality support services. How do Alaskan residents see us, and are we reliable to assist when issues arise? We recommend ADPH utilize the BSC to help develop their accreditation goals and reevaluate as necessary when it is time to renew documents and accreditation. Below is our scorecard. You can see our goals as well as our measurements, goals on the left, measures on the right, and each category. In regards to requirements for the Alaska Department of Health and Social Services, the Public Health Accreditation Board places a substantial focus on local health departments engaging with governing entities and policymakers. The purpose of this measure is to assess the State Health Department's collaborative process for sharing and analyzing information concerning state health, state health challenges, and state resources to develop a state-level community health assessment. BHAP requires local health departments to form collaborations with CHA and CHIP as per their standards and measures, which will require outside partners like hospitals and treatment or wellness centers. ADHSS would benefit from such collaboration, and we recommend them to look outside their organization and join hands with Aquila Wellness Center and identify steps to align with the objectives of SAM-SHA. As for hospitals, hospital accreditation remains a cornerstone for ensuring at least a basic level of quality, at least for the things the healthcare system assesses. Patients want to know that a hospital provides safe and effective care, and accreditation, if done right, can be a powerful tool to offer that assurance. Studies have shown that accreditation improves the overall quality of care in healthcare facilities. In certain specialty areas, accreditation programs even improve patient outcomes. According to the Affordable Care Act, and enacted by the Internal Revenue Service, all nonprofit hospitals with federal tax-exempt status must complete a community health needs assessment every 3 years in order to maintain nonprofit status, and adopt a written financial assistance policy that includes eligibility criteria, methods used to calculate charges, applications for assistance, and actions associated with billing and collections. In regard to interagency collaboration, the purpose of this measure is to assess the health department's capacity to analyze and utilize data to identify trends over time, identify clusters, understand health problems, assess behavioral risk factors, detect environmental public health hazards, and finally recognize social and economic conditions that affect the public's health. One major barrier to completing a joint CHNA and CHA is the fact that hospitals and health departments have differing reporting requirement timelines. So another goal recommendation is to develop partnerships with key stakeholders, including other rural providers, such as federally qualified health centers, rural health clinics, and other non-health entities that serve rural populations. Another recommendation is to develop a joint implementation strategy to share scarce resources and reduce burden to a single organization. In regards to the Alaskan Department of Health and Social Services progress, the division at ADHSS is actively pursuing accreditation status with the National Public Health Accreditation Board. The process of obtaining initial accreditation status will give the Division of Public Health the opportunity to assess its performance against a set nationally recognized standards and measure based on the 10 essential public health services. The assessment will encourage the division to build on its strengths and work to address the identified gaps to manage and maintain an effective state health department that works to protect and promote the health of Alaskans. Finally, in regards to our proposed intervention strategy, this process includes the collaboration between ADHSS and SAMHSA to create materials tailored to Alaska's substance abuse needs. This coordination will then include the accreditation coordinator to ensure that ADHSS is on track with the accreditation process. Between the conduction of a CHA and a CHNA, a chip can be created that pertains to Alaskans' needs. Through these two assessments and improvement plan, a strategic plan can then be created in order to achieve accreditation from the PHAB. In order to carry out the intervention strategy, the goals that accompany accreditation need to be identified. These goals include decreased substance misuse through prevention and educational services, expanded treatment services, and expanded recovery services. These goals will be carried out by substantial SAM-HSA involvement with ADHSS. This involvement includes routine check-ins in cities and local communities where needs are present, training sessions for treatment and recovery services, and SAM-HSA-oriented substance abuse education classes in middle schools and high schools. This brings up the next section of the intervention strategy, which consists of conducting a CHA and CHNA. These are both needed for a health assessment. Once these assessments are conducted, a CHIP can be created. This health improvement plan includes completing the goals and measures of the intervention, the partnership between ADHSS and SAMHSA. Once a CHIP is created, then the strategic plan can be developed through the proper accreditation channels through ADHSS and all of the staff. A CHIP and strategic plan will come together and result in PHAB accreditation, hopefully by the end of 2022. Below are our references.